We're going to be giving naloxone today through a direct IV. It's a demonstration purposes, so I'll be basically walking through everything. So first things first, we're going to check out on MAR. We've got an order for naloxone 0.1 milligrams IV stat for rest less than 8. We're going to go to our IV monographs. Check this out. So over to naloxone. We're going to see if we can even give it direct IV. Yes, we can. We can give it undiluted, but today we're going to be diluting it. So we're going to take 1 ml of our medication with 9 ml of normal saline for a total concentration of 0.04. We're going to give over 30 seconds. We've got a compatibility that we're going to check with the bedside, make sure that that's all good to go there. We're going to be looking at our dose effects here, monitoring at the bedside, and then we're also going to take a look at our dosage. So 0.1 milligrams to 0.2 milligrams, 2 to 3 times, repeat for 2 to 3 minute intervals until our desired response. Let's go ahead and do our med math. So our med math is as follows. We've got an order for 0.1 milligrams. Our concentration is 0.04. Desired dose versus have on hand times our quantity gives us a total dosage of 2.5 milliliters. Our syringe capacity, we know that we're going to be diluting with 9 mils of fluid. So our total is 10 mils, 1 mil drug, 9 mil fluid. Our dose is 2.5 milliliters and our waste is 7.5. So let's get our stuff ready. So I'm going to give my hands a wash and we're going to get all our supplies out. So we've got our naloxone. Let's do our first check. Naloxone, not expired. Great. We've got our normal saline, not expired. We've got a flush, a 10 mil, a blunt, some unopened alcohol swabs, and a pen. Look at that. Okay, so let's go ahead and clean the tops. 15 to 30 seconds. Gonna leave that sit there. We're going to go through our 7 rights of medication. So is this the right patient? We've got our MAR here. We're going to cross-reference with 2 patient identifiers at the bedside. Our drug, we've got naloxone, 0.4 milligrams, expires 12/20/35, and our mix is normal saline, not expired. Dosing, we're 0.1 milligrams. We've established our med math, that's 2.5 mils. Time, it's a stat medication. And route, we're going to be giving an IV. Reason, because this is going to be a reversal of respiratory depression, and we're going to provide the right documentation. So we can get this ready here. We're going to put 9 mils of air into our sodium normal saline here, so that makes it easy to pull out. 9 goes in. Now we can go ahead and take 1 mil out of the medication. So it's a little bit sticky. It's pretty full. There we go. We've got 1 mil there. I'm going to do proper method here. I actually don't have to do that because we're going to be adding just 9 mils. So go ahead and keep that on the table here. Just as I suspected, we got a lot of air but no medication out, so put that in there. And we're going to be pulling this total syringe volume to 10. We're dealing with some air here, folks. Okay, we've got a total syringe volume of 10. We're going to waste down to 2.5. So that's wasting 7.5. Okay, we've got it down to 2.5 there. We've wasted. Now we need to affix a medication label because we've got a medication in here, and if I had to leave or whatever, we want to know what's in here. So, right patient, we're going to be putting in here the drug. We'll do our second check. It's not expired. Naloxone or sodium chloride, not expired. We got our amount added by me, today's date, the room number, and the time. So we're going to be fixing that right now. Okay, let's take everything we need to the bedside. First, I want to put this stuff away just so that it's nice and tidy for the next person. So final check, we're going to be doing naloxone 12/20/35, 0.5. Normal saline now expired. I've dispensed my medication, so I'm going to dot my MAR. We're going to take our supplies to the bedside. Hello, my name's Ben. I'm a student nurse. Coming into the room, patient's under respiratory impressions, but we're going to still do that 2 patient identifiers at the bedside. So we've got our MAR, name, date of birth, great, PHN matches, no allergies. We're going to bring the bed up to a safe working height. We're going to pause our infusion, beep, and it is compatible fluid with our naloxone. We're going to be cleansing the site for 15 to 30 seconds, 20 to 30 seconds, right, on here, and I'm just going to be holding that to get our set there, make sure not touching anything. I'm going to get my normal saline out here so that it's ready. Okay, 2.5 mils. We're going to affix to the closest Y site here. We know that this IV is patent because it's just running fluids, so we're not going to be concerned about having to flush for patency. I don't see any signs of infiltration. We're going to be pushing this med over 30 seconds. That 2.5 mils our dose. Next, we're going to be affixing our normal saline to be applying at the same rate for 2.5 mils. Great. Take that off, uncap. We're going to restart our infusion. We're going to make sure we reassess every 2 to 3 minutes until we get that desired dose. Make sure we bring the bed down to safe working height, call bell and reach. IC drips in the chamber we're running.